So first, just a brief introduction to our presenter today. Is Dave Chandra is a senior policy analyst at the Center on Budget and Policy Priorities. In that role, he supports state efforts in implementing national health reform as well as preserving and strengthening existing healthcare programs for low-income populations. Prior to joining the center, Dave was the director of the Office of Healthcare Innovation at the DC Department of Healthcare Finance, which included management of health insurance exchange planning activities for the District of Columbia. We're really excited to have Dave today, and go ahead and get started there.
Great, thanks Deepak. Happy to join you all today. Excited because we're a little over a week and a half away from open enrollment. And I'm obviously happy to participate in a webinar for Virginia since, as Deepak mentioned, I also do volunteer to be a certified application counselor in the Northern Virginia area with Northern Virginia Family Services and work with some of the great folks there as well as with Enroll in Virginia and have been able to meet some amazing volunteers and staff. And so, you know, while I get to do it once or twice a week during open enrollment, I know most of you do it full time, and so very impressed with all the work that you all do and excited about what we're going to do in the next open enrollment cycle. So in this presentation, we're going to focus extensively on health plans and how we're helping consumers evaluate their health plan options and then pick a plan. So sort of the second part of our appointment, the first half being eligibility and getting their tax credit determination, this being the second half where you sort of help them find the right plan for them. So the first half of this webinar, we're going to spend really diving into deep detail about private insurance and the elements, both so that you get comfortable with them, but also so you're comfortable talking about them to consumers to help them get educated on it. Then we'll pause for questions, and then the second part, we're going to actually do some live web browsing where we're going to go into several case example scenarios and walk through how we might help those families. So we'll go ahead and get started, and the first thing to notice is that there's four main parts of insurance, private market insurance. There's the monthly premium, which I know all of you are familiar with. It's the membership fee that someone has to pay each month to maintain coverage. Very important to stress to consumers the importance of paying this and paying it on time because, as you know, there can be dire consequences if they miss payments or if they get delinquent. The second main part is the cost sharing. So that's the deductible, the copays, the out-of-pocket maximum. And we often refer to this second bullet as the plan design. So you'll see that in insurance industry, folks will refer to it as a plan design. So that's the cost sharing structure. The third bullet is what's covered. So what are the services and benefits covered? What are the drugs included on the formulary? And then the fourth bullet is where can you go to get these services? So that's the provider network. That's the doctors and hospitals and pharmacies you can go to. So let's go talk about cost sharing now. So one of the things we see with consumers is they often have a lot of difficulty understanding some of these terms, especially if they haven't had insurance before. So things like deductibles and out-of-pocket maximums. So one of the things I might do is when I'm sitting with a consumer, we might take a piece of paper and try to draw out some of these things so they can understand them better. So we might say, imagine you and your family have a total amount of medical expenses through the course of the entire year. And let's say your plan has a deductible of, say, $1,500 and an out-of-pocket maximum of $5,500. So when the consumer goes to get any medical care through the first part of the year, we'll explain to them that they'll have to pay the whole cost of that care. The insurance company won't pay anything. They pay for the whole thing out of pocket. And as they do that, once they accumulate $1,500 in medical bills, they'll now meet the deductible, or they've hit the deductible. You can describe it either way. So any medical care they get from that point on, they now split the cost with the insurance company. They just pay the copay or the coinsurance, and the insurance company picks up the rest of the bill. So through the course of the year, as they're paying copays and coinsurance, that's going to accumulate. And once that total accumulates to an additional $4,000, that $4,000 plus the initial $1,500 equals $5,500. So now they've hit or they've met their annual out-of-pocket maximum. And from that point on, and that might be in the middle of the summer, it could be late in the year, it depends on how much health care any given family uses. From that point on, if they go back to use any medical services, the insurance pays the whole cost and they don't pay anything at all. Now this is a very simplified way to walk through this, but it's sort of a starting point to help the consumers understand some of these terms. And so now we can go into greater detail about deductibles and the different types that we'll see in the health plans in our area. So first thing I wanted to note, and this is from the Washington Exchange, it happens to explain this information a little more clearly than healthcare.gov, and so I use it as an example. And we just want to make sure folks are very comfortable understanding that The deductible amount will be different if someone's shopping as an individual or if they're shopping as a family. And I'm sure most of you all who are returning are very familiar with these concepts. But again, if someone's an individual and you're helping them buy coverage, there'll be a certain amount for the deductible. In this case, $2,750. If they're shopping with any family members and they're buying a family policy, the deductible will be different. And it often is double the amount of the individual. Sometimes it might be even higher than that. Now, some plans offer out-of-network coverage. Not all plans do, but some do. And if they offer out-of-network coverage, there'll be a separate deductible for the out-of-network care. So as you can see here, the deductibles for out-of-network are actually double that for in-network. And that tends to be the case. It might be double or even more. And so if someone wants to get care that's out-of-network, you can help them find a plan that does that, and we'll talk about that more later. But if they go to any in-network doctors, any expenses they incur will count towards the in-network deductible. But if they go to an out-of-network provider, that'll all count towards the out-of-network deductible. So it's just important to explain to them how that works. Now, when you're looking at deductibles for any plan on healthcare.gov, they'll list it. Here's the screenshot of healthcare.gov when you look at the plan page, and it'll have a deductible listed there in big in the center. So in this case, $4,000. When you scroll down to the prescription drug section, though, there may be a value listed in the row that says prescription drug deductible. In this example, it says $500. So this implies that it has a separate prescription drug deductible. So that means if anyone gets medical expenses from a pharmacy, so if they're filling prescriptions, they'll have to pay the first $500 out of their own pocket. And once they've paid $500, now they've met the deductible for prescription drugs. And now they can just pay the copay or coinsurance listed above it, and the insurance company will pick up the rest. But any medical services they get, so if they go to the doctor, they go to the hospital, they'll still have to pay the full cost of that until they hit the $4,000 medical deductible. Now, many insurance plans actually just combine the two into one deductible, and if that's the case, you'll see it listed the way it says here. So you can see in that row, it now says included in plan deductible. So that means it's a combined deductible. It's one deductible, $4,000. It doesn't matter if you go to the pharmacy for services or if you go to medical doctors. All of that counts towards the same deductible. Now, if you're helping a family buy coverage, there's two main types of family deductibles. There's the aggregate deductible, and this is one you're probably familiar with. It's where every family member, any medical expenses they get through the course of the year, you combine them all together, and once the total reaches the $6,000 in this example, then they've met the deductible, and then they can just pay the copay and coinsurance. So a different model is the embedded deductible. Now, this is where each family member has sort of a mini deductible that's attached just to them. And so in this case, let's say that there's one parent that happens to have a lot of medical expenses. And so they reach the $2,000 in medical expenses very soon. Once they do that, they've now met their embedded deductible, and so they'll just start paying copays or coinsurance. But the other two family members will still have to pay the full cost of any medical care until they reach their mini deductibles. Now, if any one person or any two people in this group happen to reach the $6,000 in their combined expenses, now the whole family has met the deductible, even if that last person, let's say the child, hasn't had any medical expenses at all. So at that point on, everyone just pays copays and coinsurance. Now, one of the hard parts is that when you're looking on healthcare.gov and some of the resources that it provides, it doesn't say whether these policies have an aggregate deductible or an embedded deductible for families. So it may be something we have to contact the insurance company to find out at the beginning of open enrollment. So another thing just wanted to highlight now that we move over is to the copays and coinsurance. And again, probably something most of you are very familiar with. On the left-hand side is a plan that happens to use a lot of copays, so it has, that's a flat dollar fee every time you go to the doctor or per day for the hospital or per visit. And the plan on the right happens to have some coinsurance, in this case for inpatient doctor and for the inpatient facility. And these are both plans sold in the area I volunteer in Northern Virginia. Now, there's two main things that come up when consumers face this concept of coinsurance. The one thing is they might look at the 20% that's listed on the right, and they might say they think that that's what the insurance company pays, and that they, the consumer, have to pay 80%. And so it's important to clarify, no, what you pay is 20%, the insurance company pays the rest. And then another thing that's commonly asked is, okay, well, 20% of what? And unfortunately, we don't have an answer for that. The reality is because healthcare prices aren't transparent, and they're really based on the contracts between providers and health insurance companies, we don't know what the cost is of any given hospital visit or even a doctor visit. And in fact, it's different depending on which doctor you go to and which hospital and which insurance company. So for some consumers, that uncertainty sort of is a little troubling. And so most consumers don't like the concept of coinsurance. The reality is that most plans have some coinsurance on something, maybe on hospitals or on some high-cost stuff. And especially because plans with more coinsurance tend to be cheaper, and a lot of consumers tend to buy plans, they really want plans that are affordable, it's likely consumers will likely have some services that have co-insurance attached to it, and so it's just important to explain how that works. Now, we mentioned before the in-network and out-of-network deductibles, and the same concept applies to copays as well. And here's an example from the Colorado Exchange. Again, it happens to explain this information better than healthcare.gov, so I use it as an example. And you can see here that the copay amount, if you go to an in-network doctor, is $30 for a primary care visit or $60 for a specialist. But if you go out-of-network, it's different. It's 50% co-insurance. And it is true that for out-of-network, it tends to be a much higher copay or co-insurance, and it tends to be as high as 50%. So if a consumer So generics tend to have the cheapest copay. The next step up is the preferred brand name drugs. That tends to have the next higher copay. The non-preferred brand name drugs has an even higher copay. And then the top category is specialty drugs, which tends to have the highest copay. And so for a consumer, when you're looking up whether their drug is covered, it's important to see not just is it covered, yes or no, but what drug tier is it in. So one of the most important things I want to emphasize is that when we're helping consumers look at plans, a thing that can be very useful to note is whether or not the plan has anything that's exempt from the deductible, any services. So here's an example of a plan that's also from Fairfax County, and it has a deductible of $3,350, which is not huge, but not small. And so most consumers, like I said, are very price sensitive. They're very concerned about the monthly cost. And so if they're going to be concerned about monthly cost, chances are they're going to look at plans that might have higher deductibles. So in this case, you can see that many services you have to meet the deductible first, and then you pay 15% co-insurance. But there's several services here that are highlighted where you don't have to meet the deductible first. You just pay the copay right away on day one. And so we refer to this as first dollar coverage. It has some options for you to get care without having to meet the deductible. So for someone who is really worried about price and they buy a plan that has a moderate to high deductible, if you find a plan that has some services exempt from the deductible, it's a way that they can have access to some basic primary care services. In this case, the PCP visit's $45, generic drugs is $15. They have some access to those services without having to meet the deductible. So there's different ways insurance companies might list this. And so it might say that that service is exempt from the deductible. It might say the deductible does not apply to that service. It might say the deductible is waived for that service. And they might say it's before the deductible. So it'll list the copay amount, say $45 before the deductible. Whereas if the deductible applies, it'll say $45 after deductible. So those are some useful terms to keep track of when you're looking at plans, since they often can help us find a plan that balances cost with access to primary care. Now, on a related note, I wanted to explain just briefly things about HSA plans. So HSAs are health savings accounts. I'm sure some of you are familiar with that. It's an account that a consumer could put money into, and then they can use it with pre-tax dollars to pay for medical expenses as long as they buy a high deductible plan. So these are two plans. They're very, very similar, sold by Kaiser. And the plan on the left is an HSA plan. And one of the reasons this is important is because the rule says that if it's an HSA plan, it cannot exempt anything from the deductible. So you have to meet the deductible before you get to have the insurance benefit kick in. And because it has a high deductible, you're able to use this HSA account that has pre-tax dollars, and it rolls over from year to year. The problem is that most consumers we work with who are lower income don't have a lot of extra money lying around to put into an HSA. So they can't benefit from any of that tax advantage if they buy an HSA eligible plan. But they're getting stuck with a plan that has nothing exempt from the deductible. So if you'll notice, the plan on the right is almost identical, except several of the services are exempt from the deductible. But you'll notice it only costs $8 more. So if you're working with the consumer and they're trying to balance issues of what their monthly cost is with access to coverage and how much it'll cost every time they use the doctor, the plan on the right might give them some access to care without having to meet the deductible, which in the end could actually be financially better for them. So one place you can find a lot of this information, again, I'm sure some of you already are very familiar with using, is what's called the Summary of Benefits and Coverage. So when you're scrolling on the plan page, you can click in the upper right-hand corner, and it'll take you to a PDF. And every insurance company has to have one of these documents for every single plan they sell in the marketplace. And it has things like the deductibles and how they work. Is there a separate prescription drug deductible? When you scroll down, the next page will start listing the services and the copay amounts, like things like primary care and testing and drugs. And so it's a very useful tool to find out more information about the different plans that you're looking at with consumers. So I want to touch briefly on the cost-sharing reduction plan. So as those of you know that certain consumers, if their income is below a certain amount, if it's below 250% of the federal poverty level, they qualify for certain special silver plans. So every insurance company has to take their silver plan they sell on the market, and they have to create 3 different versions of the silver plan. And each version is tied to a particular income level, and you can see the income levels on the top. And it sort of determines how generous that plan is based on for someone's income. So as you can see here, the plan that's listed as the 73% silver is slightly more generous than the regular base silver. And this insurance company happened to make it more generous by reducing the deductible and reducing the out-of-pocket maximum. To make a plan for people below 200%, this same insurance company reduced the deductible and out-of-pocket max more, and then reduced some copays as well. And then to make the most generous plan, the 94% silver version, which is even more generous than platinum, this is for people below 150% of poverty. This insurance company lowered the deductible a lot and the maximum out-of-pocket, and then lowered a bunch of the copays as well. But you'll notice they didn't change anything related to the prescription drugs. Now, a different insurance company for a different silver product, they might, they have to make the same 3 different versions of silver, but they might lower the copays by a little bit, but maybe they don't lower the deductible as much. So insurance companies have the ability to sort of play around with how they make these variations of the silver plan for the different income categories that we're looking at. Now, when you're working with the consumer and you'll get this notice, this is a sample notice after they finish their application and submit it, and it'll list their tax credit amount, and if they're eligible for CSR, for cost-sharing reductions, it'll list this language here in the bottom. But it doesn't explicitly state which version they're eligible for. The only place that happens is on this screen right here. And you can notice in this box, it says silver covers 94% of the cost. Or it'll say 87, or it'll say 73, or it'll say 70, depending on the income category of the particular client. Now this screen pops up in between that stage when you're helping a consumer set the tax credit amount that they want to use, but before it actually shows you the actual prices of the products. It's sort of one of those tutorial slides in between. And so it's important to keep track of that and note what that value is, because that'll be useful. It tells you how valuable that silver plan is to help a consumer understand, is it worth paying more money to get a silver than buying a bronze if they're debating between bronze and silver. So now I want to talk just briefly about benefits. So the Affordable Care Act, one of the best things it did is it really standardized all the benefits that all these insurance plans have to sell. So for the most part, there shouldn't be any variation on benefits listed here. There is 2 main exceptions, and one is prescription drugs. Insurance companies can differ a little bit about how they treat prescription drugs, what they cover and how they treat them, and then whether or not they include pediatric dental care and vision care. So even though it's a required benefit, the insurance companies aren't required to include it. So in terms of prescription drugs, one of the things you'll probably do with consumers if they have medications is look up if they have a medication and see is it covered or not. We also need to know, well, what tier is it in? So this is just a sample search of some plans in Illinois. And the plan on the left, when we're looking for this drug called Humalog, which is for people who have type 2 diabetes, and it happens to be covered at tier 2, whereas the same drug covered on the plan on the right is covered at tier 4. So when you're working with a consumer and they have this drug, obviously it's important to say, well, yes, this drug's covered, but also let's note which tier it's in, because that'll really determine how much it costs every time you go to fill out a prescription at the pharmacy. So another thing we mentioned just briefly just now is that pediatric dental isn't always covered. So you can see this plan on the left. When you scroll down on the healthcare.gov site for this plan and it lists the child dental coverage, it'll say not covered for the plans that don't include it. Now the plan on the right does include it. This is the Kaiser plan, which in our region tends to include pediatric dental as well as dental for adults. And so it shows you what the copay amount, coinsurance amount is if someone goes and gets dental coverage. So if a consumer wants to buy a plan that has dental coverage for their kids, if they buy the plan on the right, it's included in the price of the premium. They pay that premium, it includes all the medical care and dental coverage. If they happen to buy the plan on the left and they still want to get dental coverage for their kids, they'll have to buy a separate standalone dental plan, also on the marketplace, and that can be anywhere from $8 or $20 or $40 additional that they'll have to pay to buy on top. So it's important just to note that whenever consumers are interested in finding this coverage for their kids. Now, also in terms of benefits, the one other place that carriers might vary is what's called other coverage services. So this is at one of the last pages on the summary of benefits document we talked about before. And when you scroll to this page, it'll list in this box any other services that are not required by the law, but that this insurance company happens to offer. They offer them as sort of added benefits. So things like acupuncture and chiropractic care and routine foot care for diabetics. So if a consumer comes in and let's say that they're interested in infertility treatment, it'll be important to note which companies in your area happen to include that as an other covered service and which companies don't. So one of the things you can do early on during open enrollment is get these documents for each of the companies and sort of make a table of all these different additional services that are slightly less, they're more rare, but then you can keep track, well, which company covers what, and that'll help you use sort of as a cheat sheet in case someone comes asking for one of these services, if that's important to them. So I want to talk about networks. Again, I'm sure some of these terms are very familiar to many of you. So things like PPOs and point of service and HMOs and exclusive provider organizations. There's some differences in terms of how they manage care and how they might treat consumers. But the main issue that we're really interested in when we're looking at these labels is whether or not they include out-of-network coverage. So if a consumer wants out-of-network coverage, then the PPO and point of service, those are the two plans that include out-of-network coverage. The plans on the bottom, the HMOs and the EPOs, do not include any out-of-network coverage with one exception, which is if you go to the ER in an out-of-network hospital. But for the most part, all other coverage is not included if it's out-of-network. So if a consumer wants out-of-network coverage, you have to be sure that you're looking for PPOs or point of service. And on healthcare.gov, you can sort of filter for that. But the reality is PPOs and point of service tend to be more expensive plans, and so most consumers, when they're shopping, depending on your market, are likely going to see a lot of HMOs and EPOs. Now, that might be okay, because they might have just as much doctors as the consumer needs, but again, it's important just to verify that. So to follow up on that point, just want to highlight the different ways that networks might be presented of the different plans in your area. So here's just an example of 3 different plans. The first 2 are sold by the same company on the left, and the second is sold by a different company on the right. And this is just sample data, and we're saying the black dots are doctors and the red dots are hospitals. So let's say company A has an HMO plan that they sell that doesn't have a lot of doctors. It's called their narrow network product. But they might sell a different product, also an HMO, that happens to have a lot of doctors or a lot of hospitals. So that's their broader network product. And let's say there's a different company that sells in your marketplace that has sort of an integrated network. That might be like a Kaiser or a Geisinger. And so that has, doctors. It might be a lot, it might be a little, but they might be located all in one office area or one medical complex, or maybe 1 or 2 sites around the area. And they might have some doctors or many doctors, or some hospitals or several hospitals. There could be another company that sells a PPO that has even more doctors. And so there's different ways that insurance companies can structure it. The problem for us is that when you're looking on healthcare.gov, there's no easy way to recognize, is this plan a narrow product or a broad product? It's not labeled in any way. We're hoping in the future that healthcare.gov moves to try to do something like that. But for now, one of the things you can use as sort of a trick is at the beginning of the year, when you're looking at the different products in your area, the different network styles that each company has, you can maybe do a search for primary care providers within 10 miles of your zip code, or number of cardiologists within 10 miles, or number of hospitals within 10 miles or 20 miles. And so that number will give you sort of an approximation of how many, how big is that network, and then you can just keep that value for each of the products in your area, and that'll give you just sort of a cheat sheet in case someone comes and they talk to you about network size. So now I want to go over a few trends that we're seeing in the marketplace, and we can pause for the first round of questions. The first thing we're seeing is that there are many, many plans, there are more plans that are having more co-insurance instead of copays. So this is a plan that's sold in my hometown area in western Pennsylvania. And the reason I bring it up is because in 2014, it was actually the cheapest silver plan sold in the marketplace in that region. And in 2015, this year, it's the second cheapest plan. We know that a lot of consumers, when they're shopping in the marketplace, end up buying the cheapest or second cheapest silver. So these are the kind of products that they're going to be faced with because they're very sensitive to price. So it's just something to keep an eye out for. Another thing I wanted to do is revisit the prescription drugs that we talked about. So we mentioned before that there's 4 different categories, and most insurance companies label them as level 1, level 2, level 3, level 4, or tier 1, tier 2, tier 3, and tier 4. But you'll see in this example, this insurance company actually took that lowest category, that level 1 category of generic drugs, and split it into 2 subcategories. So preferred generics and non-preferred generics. One is $10, one is $20. Some insurance companies have even taken that top level of the specialty drugs and split that into 2 subcategories, preferred specialty drugs and non-preferred. So instead of having 4 tiers, you might have up to 6 tiers. Now, what can be annoying is that when you're sitting with the consumer and you're looking up a prescription, you might look up different plans, and one might have 4 tiers and one might have 6 tiers, and they'll both list the same medication as tier 2. But that tier 2 means different things and will have a different value because there's different tiering in each of those insurance companies. So it's important just to keep track of that. Now, when you're looking on healthcare.gov, though, and here's an example from Austin, Texas for that same plan we just looked at, you'll notice for the generic drugs, it says $17. And that's because healthcare.gov still only has 4 rows for prescription drugs. They don't have space to add additional rows if an insurance company has more than 4 tiers. So here, they don't list it as $10, and they don't list it as $20. They don't list it as $10/$20, and they don't even list it as $15, which is halfway in between. They list it as $17. And what I found, whenever I see a $17 in this generic drug row, it often means that it's a split tier for the generic, so you can verify that by clicking on the summary of benefits and coverage, and it might tell you, is it just 17 or is it a split tier with 10 and 20? So it's something to keep an eye out for. Another thing we're seeing is something that we've dubbed the 3-step copay. And this is where insurance companies, especially if they have sort of a high deductible, they might offer some access to primary care for, say, several visits. So they don't exempt all of the primary care from the deductible, but they say the first 3 visits, you don't have to meet the deductible. You just pay this copay amount. The reason we call it the 3-step copay is because you'll pay the 3 different prices for the same exact service depending on the time of year you're in. So at the beginning of the year, you'll pay $35 for those first 3 visits. After that, any additional visits, you'll pay the full cost of it. Then once you've hit the deductible, you'll pay 35%. Now this can be an important option because for consumers, again, who are very worried about price, they're just looking at low cost, it might have a deductible like this, $4,500 in this bronze plan, which is, you know, not super high, but not low by any means. But at least it gives them access to some primary care visits before the deductible. So again, balancing that monthly cost with some access to primary care. Now, I just want to show how healthcare.gov shows this information. You'll see here that it says $35/35% coinsurance after deductible. It does not mention how many visits you get for $35, so you'll have to click on the summary of benefits to find that out. So I wanted to revisit the issue of networks again. We talked before about how we need to evaluate networks. Well, the reality is, in the trends in the marketplace plans, is that more insurance companies are moving towards this narrow network model. It's one of the ways they can limit their costs and then have lower premiums because they know people are really buying the cheaper products. So for some consumers, if their doctors are in network, in a narrow network, that's fine. If there are 1 or 2 doctors that they see as a network, they don't mind. They can save money in the cost. But for consumers that tend to have larger needs, so maybe people with chronic conditions who go to a lot of providers, maybe they get a lot of referrals, then obviously they may not be best served by a narrow network product. And so it's important to keep an eye out for that and see which are the products that have broader networks. Now, some insurance companies, they're not making their network narrow, but they're slicing their network into different tiers. So if you go to a tier 1 provider, it's a cheaper copay. If you go to a tier 2 or tier 3 provider, it's a more expensive copay. So this example, which is from Philadelphia County, Pennsylvania, and it shows here that if you go to a primary care doctor, you pay $25 for a tier 1 doctor, but you pay double if you go to a tier 3 doctor. But you can really see this immediately if you look at this facility fee for outpatient surgery. It's a $250 copay if you go to a tier 1 preferred provider, but if you go to a tier 3 provider, not only is it 5 times as much, now the deductible does apply because the deductible is waived for a tier 1 provider. It's not waived for a tier 3 provider. So you could be paying thousands of dollars more for the same exact procedure depending on which provider you go to. So when we're sitting with the consumer and we're looking up whether their provider's in network or not, it's important not just to say, well, yes or no, but what tier is it in if this product happens to have a tiered network. So when we're looking up people's providers, we're going to, on healthcare.gov, you'll click on the provider directory site, and it'll bring up the insurance company's website. And you'll look at the name of the plan on healthcare.gov, and then you'll look at the name of the plan listed on the the insurance company website, and they don't always match. And that can be very frustrating because you don't want to make a mistake when you're choosing the network because that'll give you flawed information. So in this case, in this Kansas model, Kansas City area, I actually had to do some Googling to find out, well, what network applies to this name. So that can be an additional step you may have to do if you're in an area where it's not clear. Even when it is clear and you're easy to pick the network and you look up the provider's name and it says, yes, they're in network, the consumer might go in January and go to that provider only to learn that the provider is not in network. Maybe they are no longer in network, maybe they were never in network and it was just a mistake, and so those inaccuracies in the directories can be really problematic. So if it's really important for a consumer for a particular doctor to be in network, and they're really making a choice of which plan to buy based on that information, it might be worth double checking that information by calling the provider or calling the insurance company to verify that information. I just want to talk on some last few moments before we stop for questions. This is just an example of how much there's variation in premium from year to year. So this is data on the second lowest silver plans, in the Northern Virginia region where we volunteer. And you can see here in 2014 there was a Care First Blue Cross Blue Shield plan that was the second cheapest silver plan. But in 2015 it jumped up to be the second most expensive silver plan. It jumped up by about $50 for someone in this age range. So every year it's going to be important to remind consumers that the prices and the products, they're all going to change quite a bit. So it's really important to come back and shop every year, even if you like your plan this current year. Because not only will the prices change, but which products are the cheapest and second cheapest and third cheapest, the orders will change and which companies they are, all of that might change. So it's very important to remind them to come back. And not only will the prices change, the plans themselves may change. And so here's a tool that's available by a site called ProPublica. And you can go online and put in your zip code and put in the age of a consumer and pull up the plan that they currently have. This is an example from last year, open enrollment, where you can pull up the 2014 version of a plan, and then it'll show you side by side the new version of the plan. And it'll show in red anywhere where the prices went up, and in green anywhere where the prices went down. And so for many plans, maybe nothing changes, so the deductible stayed the same, the copays all stayed the same. The only thing that'll change is the price. Usually the price goes up, but on some rare occasions the price goes down from year to year. Or some plans might just tweak a little bit. So in this example, you can see they just tweaked some of the copay visits. They tweaked them down a little bit. Or they might change a lot. And so they might change some deductibles, copays, they might change it dramatically. So it's a useful tool if someone comes and they really like their plan and you can kind of show them how that might change for next year. And we're hoping that ProPublica does, in fact, take the 2016 data and make it available as well, because it could be a useful tool. So with that, we're going to pause and see if there's any questions here for the first half before we go on to the next part of the presentation.
Okay, Dave, yeah, this is Deepak again. We've had quite a few questions come in through the chat box, and if you still have more questions, do use that question box, and we'll have another chance to ask questions at the end. First one, question about the prescription drug deductibles. Does that prescription drug deductible go towards meeting the medical deductible as well?
So no, it doesn't. The reason they have a separate prescription drug deductible is because any prescription medication expenses will only count towards that prescription drug deductible, and the medical expenses you have count towards the medical deductible, but they don't cross over. The reason that can be both good or bad, if you have a separate deductible, then technically you'll have sort of two deductibles, and that means it's an increased amount. In that example we saw, one was $4,000, one was $500, so you'd have to spend $4,500 before you meet both deductibles. But if you're a consumer that's relatively healthy, but you just have a lot of prescription needs, and you happen to spend $500 in prescriptions within the first 2 months, you've now hit that prescription drug deductible, and now you can just pay the copays for the rest of the year. And so if you happen to have mostly prescription needs, that separate deductible model might actually be better for you. So it's different depending on each kind of consumer that's approaching you.
Thanks, Dave. The next question is about the health plans and the changes from year to year. What should consumers expect to get at the as the plans change year to year? What do the plans send to them?
So I know that they are sending notices to consumers about sort of updates in price and other things. I'll have to admit that I'm not 100% sure of what notifications they provide to consumers based on if the structure is changing. And that's a great question, and we should try to find that out. That presumably would have been going out very, very recently, or if not right away. So we can try to find that out. They might say if the deductible is changing, et cetera, and that's useful to know.
Okay. Thanks. Now, another question that goes towards some of the definitions here that you've been using. Sateni wants to know, what's the difference between a PPO and a POS?
So it's true that there are some differences, and some of it is related to how they manage consumers. So do you have to have a primary care provider? Do you need referrals? How's your care managed? For the most part, we found that those older differences don't apply as much. So in point of services, technically you're supposed to have referrals, and PPOs you don't. For the most part, I'm not seeing that adhered to. Even HMOs, they're supposed to require you to have a PCP and require you to get referrals, but some of them are open access HMOs where you don't need referrals and you don't need a PCP. So the most important for us to really remember is whether or not they have out-of-network coverage. And again, the PPO and point of service, they do have out-of-network coverage, and the HMOs and the EPOs, they do not have out-of-network coverage.
Great, thanks. Couple questions here that going towards drug tiers, prescription drug tiers, formularies. First one is just any tips. One navigator in Northern Virginia says that oftentimes directories, the formulary directories, are not labeled as tiers, and it's difficult to figure out which tier a drug might be? Any tips on how to kind of get consumers that information?
We're going to look more in the second half on how to look up prescription drugs and other things like that. It is true that sometimes some insurance companies are harder to navigate than others, but all of them have to list what tier their drugs are in, and part of it just might be deciphering their codes. So we can look at that later in the example, and if that isn't adequate, you can bring that up at the end, and we can try to talk more about that.
That's great. That's great. And one of the questions that one of the attendees want to ask about those codes is, when looking at prescription coverage, can you explain the QL and what it means for certain prescriptions? So you can put that away.
We can go look at that. Some insurance companies have some of that. We'd have to go back and, there are different codes, and I just don't recall it. I have to go back to my biochem days to recall this, but I can't remember if it's quantity limited. So some of those have maxes, some of them have prior auth, some of them have step therapy requirements. There's different utilization management that insurance companies use. I just have to go back and brush up on the legends from one of the insurance companies to do that. So I apologize for not having it off the top of my head, but can certainly find that out and try to get back to everyone either today or afterwards.
Great, thanks, Dave. We'll do
Why don't we take one or two more, and then
we'll do two more questions, and then we'll kind of move on. A question comes in about preventive care services that are available without cost sharing.
Yep.
Just a discussion about that, just generally, and kind of how to show that through healthcare.gov, but also just generally like how, where those benefits are.
Yeah, it's a great point, and it is one that's come up a few times in these webinars, and I've thought about adding a slide on it and continue to fail to do so. So maybe I just need to do that for my next webinar. It's a very good point that all preventive services there's a certain category that describes preventive services. They have to be provided by every insurance company on the marketplace with no copay, no deductible. So there can be no cost to that. So that is a great point, and that's something well to explain to every consumer. So even those that are buying bronze with $6,000 deductibles, there are plans that have to, they have to provide you free preventive services. Some consumers do say they go for a free care visit and then they still get a bill, and part of that is because if you go and you get blood work done, if it's routine checkup for regular something you get annually during your physical, that's fine. But if it's blood work and you happen to have a heart issue from 2 years ago, and they're in that same blood work they test something related to heart issues, so they might test your creatinine level or other enzymes, heart enzymes in the blood, that is considered management of your medical condition, not preventive. And so that part will get coded and get billed for. Or if you happen to get a procedure done that's regular, that's fine. But if it's a mammography but you've had breast cancer, that's no longer preventive. It's sort of maintenance. And so some of those issues come up, and we're hoping the providers get better at coding that stuff. So that's certainly a point, but it was a great point to bring up.
So one last question, and this goes back to drug tiers. Are lower tiers always less expensive to the consumer than higher tiers?
So not always. It tends to be the case. There are some cases where I've seen plans in some states where the non-preferred brand name drug is more expensive than specialty. So it might say generics is $10, brand name drugs $20, preferred brand name is 50% coinsurance, and specialty is 30% coinsurance. So for whatever reason. So that could be the case, although usually it increases stepwise.
Okay. Thanks. And there are several more questions that did come in, so we'll get back to those at the end of the presentation. But if you still have questions, use that question box and we'll get to it. If we don't get to it today, then we will be able to respond to that at the end of the presentation today.
Great. All right. Now let's move on, and let's actually do some actual scenarios where we might be helping consumers who are looking at plans and want to help select a plan. So to do that, we're going to use this worksheet that we've developed called the Marketplace Plan Comparison Worksheet, and it's available on our website at Health Reform Beyond the Basics. It allows you to compare side by side several plans and include information that's relatively, that's often commonly looked at, so certain services, prescription drugs, things that consumers tend to want, but it also has a lot of room for you to tailor this search and add in some of the blank rows, different things like providers and other considerations that consumers might have. Now, we're told that healthcare.gov is going to have some more sophistication in including this in their comparison model, especially the provider search. It might be embedded. I haven't seen it yet, but hopefully when that happens, it might help you avoid having to do this manually, and so the computer will do it for you and include it in the comparison. But it's also useful to learn how to do it manually in case that ends up being how you have to do it. So let's go ahead and start with our first example, and that's Sasha, who's 37 years old from Lynchburg City, and she makes $30,000 a year. So we're going to go ahead on healthcare.gov and help her look up some options. Now, when she comes into us, she'll say, in our example, that she's very concerned about cost, really doesn't want to pay money, doesn't want to pay more than $100 a month or something. And this is very common. Consumers will come in with an ideal fixed price in mind. And so we can go ahead and put in her zip code. And here I'm using the C Health Insurance Plans website on healthcare.gov. It's the window shopping feature before you apply. When we all work with consumers, and we're applying with them, obviously we'll be working on the actual shopping site, which is very similar, but a little different. So in this case, we'll put in her zip code. She's from Lynchburg City, so we'll select the county. We'll put her income of $30,000, and we'll put in her age, 37. And so this site does a preliminary estimate saying that she has a little over $81 in premium tax credit, and monthly tax credit. Obviously, if you're sitting with the consumer after you've applied, you'll have the actual tax credit amount in the notice. So we can take this information, and we can go ahead and put it on the top of our form. There's her name, it's the tax credit amount. In this case, she's not eligible for any CSR, the cost sharing reductions. We can indicate that. And now let's go back and look up what her plan options are. So here we can see the cheapest product on healthcare.gov for her is a bronze plan from Anthem that's $137. So right away, we know she mentioned she doesn't want to pay more than $100, but this plan's already more than that. And so she might be alarmed. And so we look at this. We can look at more details of this product. We can show it to her. It's $137. It has a $6,000 deductible, and then after you meet the deductible, it's a 15% coinsurance for pretty much everything else. That's a pretty high deductible. It's certainly a lot more than she wanted, but we can take that and just say, well, this is a starting point. So let's add this in the first place on our form. Here's the name of the plan. It's a bronze plan. Here's the price of $137. Here's the deductible. In this case, it's a combined deductible, not separate. And then 15% coinsurance for all these services, but you have to meet the deductible first. We put a check mark because the deductible applies. Let's go back and see what other options are there. Again, these, she's already might be concerned because of the price, but let's just see what her other options are. We can scroll down, and we can include, here's another Anthem plan. It has a slightly lower deductible, has a $153 premium. In this case, we just want to scroll down one more. We happen to notice in our search that this is a Piedmont Community Healthcare plan that has a little lower deductible. It's only $1 more. And it also has this 3-step copay model. You remember, if we see that $40 / 30%, that means that it looks like there might be some primary care visits that you can get before the deductible. In this case, when we looked it up, it turns out that there's 3 visits for $40 before you meet the deductible. So we can actually add this one as well. If she wanted to add the other Anthem, we could do that. In this case, we're sort of adding some variation. It's $154, has a lower deductible, and again, it has 3 visits for $40 for primary care. So we put a squiggly line there because the deductible sort of applies. But we notice these are very high deductibles. And so, even though she's very concerned about cost, she's very concerned once you explain to her what deductibles do. So maybe we say, well, why don't we just take a look at silver plans, just to look at something that might have some slightly lower deductible. So here we can say, here's the $205 Anthem plan. It's certainly more expensive, maybe double what she thought walking in, what she wanted to pay. It has a $3,350 deductible, so a little bit lower than the others. But you can see here there seems to be some things exempt from the deductible, the primary care and generic drugs and some other things. So we can look at that one. We can add that. Maybe she says 205 is as high as she'll go. So she lets us add this one. It's $205. The primary care is exempt, as are generic drugs and brand name drugs. So it gives some of that first dollar coverage. So now we've laid this out, and she might feel very comfortable picking a plan, or she might be very overwhelmed. She might be not sure which one to apply. She might even ask you, well, can you just tell me which plan to pick? And so this is a good point to remind ourselves that as assisters and navigators, we can never recommend a particular plan. So state and federal law prohibit us from doing so. But that shouldn't make you shy about talking in very great detail about these plans, and most importantly, about the consumer's priorities. So what is it that's most important to them? Which of these plans best meet those needs? So for Sasha, we can go through and we can talk about some of them. We can say, is it just paying the cheapest monthly payment, like what you said when you walked in? Is your priority having a manageable deductible? Is your priority having low copays and coinsurance when you go to see the doctor? Or is it having some of that first dollar coverage, so having some services exempt from the deductible so you can get access to primary care without having to meet the deductible? And for every consumer, their priorities might be different, and they might prioritize some things more than others. And some plans might be better at some of these priorities than others, and so there's trade-offs to go through. But the most important thing is helping to talk through in great detail with this consumer so they can identify what theirs are and help be empowered to make that decision about what plan they want most. So let's go to our next example. And this is James and Ann, and they're a married couple from Williamsburg. And their combined income is $23,000 a year. So that puts them at just under 150% of the poverty level. That probably means they're going to be eligible for some cost-sharing reductions. So let's go ahead, back to healthcare.gov, and let's update our information and put it in for this couple. So in this case, we'll put in their zip code, and they're from Williamsburg, and we'll add their income, which is $23,000 a year. And we'll put in their ages. James is 52, and Ann is 45. So once again, it predicts a preliminary tax credit estimation, in this case of almost $690. And it also says that they probably are eligible for cost-sharing reductions. And we bet they probably are because of their income level. So once again, we can take this information and we can put it on the top of our form. Tax credit amount, the fact that they're eligible for CSR. And before we keep going, I just want to note that as we mentioned on our form, we have common services that consumers tend to care about, but every consumer might be different. And so in this case, we might talk to them and say, as we're helping them, we might say, do you have any healthcare needs? Do you go to the doctor at all? Do you have any doctors? Maybe they mention, they don't mention a lot, but they say, well, we happen to get some testing done, blood work done, and we get some x-rays every now and then. So maybe that's important for them to figure out. So we'll add these two services, lab services and x-rays, when we're looking at the plans to compare. So here we'll go on healthcare.gov, and we'll pull up the different options that are here. Now, right away you notice, of these plans that are available to them, these are the bronze plans. This one is free. That's because the tax credit they get is bigger than the cost of this plan. But it has a huge deductible, and we can scroll down. And there's other $0 plans. There's many, many bronze plans that are actually free. In fact, 10 out of the 11 bronze plans they qualify for have no cost. But these have enormous deductibles of $8,000 or more. So one thing we might say is, well, these are here, but why don't we go look at the silver plans real quick, because you know that they're eligible for cost-sharing reductions, and in this case, the most generous version. And if they want to buy the cheap bronze plans, we can always come back and look at it. So when we click on silver, right away you notice there's a plan at $68, so much more than free, but it has 0 deductible, so much less expensive, much less deductible. And it has $25, and it looks like it has that 3-step copay again. In this case, we know that it gives you several visits for $25, as well as it gives you a combination of 4 visits for pre-CP or specialty visits at $25. Then you pay the coinsurance, but there's no deductible. So we could look at that plan. We can scroll down. Here's another plan from Anthem. It has a little bit of deductible, $400, but again, it's pretty low. But it looks like some of the things are exempt from the deductible. And in fact, a lot of things are actually exempt, the primary care drugs and Tier 1 and Tier 2 drugs. So we can scroll down and we can look for some other things. Here's another plan from Anthem. But in this case, it actually looks very similar. It has the same deductible, and it has very similar copays. But we might keep scrolling until we find something that's significantly different, because in these cases, all these Anthem plans happen to be very similar deductible, but just more expensive. And so as we keep going, a plan that finally looks a little different is this Aetna plan. We could have taken one of those other Anthem plans, but in this case, to add some variety, here's an Anthem plan that also has no deductible. It's a little more expensive. It's $120, but the primary care docs are free, and generic drugs are $5. So it seems less a copay. So we can take these 3 plans and we can add them to our form. Here's the $68 Optima plan. Here's the $73 plan from Anthem that exempts some things from the deductible. And here's the Aetna plan that's $120 that has no deductible. So at this point, they might feel comfortable being able to make a choice. They might want to see more plans. But again, one of the most important things is really talking to consumers about what are their priorities, what are their healthcare needs. So maybe before they didn't mention this, but now when you ask them again, do you have any doctors? They say, well, actually, we do have some doctors. We do have some things. Maybe they didn't feel comfortable bringing it up earlier. And so they mentioned that actually Ann has an OBGYN that she sees, Dr. Robertson, and she's interested in seeing if she can keep seeing her. And maybe James mentions that he has a family history of heart disease, but he doesn't have a cardiologist. And so he's interested in, how many cardiologists do these companies have? And then maybe he also mentions that he has type 2 diabetes, and so he takes a particular drug, in this case metformin, for his condition. So we can actually help them with that search to help them compare. So the first thing we'll do on the Aetna plan is we'll click here in the bottom right-hand corner on Provider Directory. And so that'll open up a browser that has the Provider Directory search site for this company. We're going to click on the second link here. It's the individual market plans on exchange on the marketplace. We'll click on that. And so that'll take us to their provider search website. Now first we have to pick the state that we're in. And so we go to Virginia. And then we have to pick the plan that we have. And so in this case, it's the Coastal Virginia option. And it's the silver $10 copay. And we'll click continue. So now it takes us to our site here. So here we're going to put in the zip code that they're in. And what are we looking for? Well, we're looking for this particular provider. We're going to type in the name. And in this case, it actually pops up. This site lets it pops up, and there she is, Emily Robertson. We can click on it and click search, and it shows us that, in fact, she is in-network for this product. This site happens to take a little bit of time, but it pulls her up. It's in-network in Williamsburg. So we can do the same thing for one of the other plans we were looking at. In this case, let's say the $73 Anthem plan. So we'll click on Provider Directory. And right away it asks us, the first thing is, what is the plan network? So here we can select the plan. And so the type of care we're looking for is medical. The state that we're in, so we'll click on Virginia. And then what is the plan network? And so we want to go down to Anthem Healthkeepers Silver X via Exchange, because that's the name of the plan. So it is right here. Anthem Healthkeepers Silver X via Exchange. Now this can be confusing because there's a lot of names and a lot of them are similar, so it's important to double check. So we click on that and click Continue. So now what we're looking for, we're going to say who specializes in OBGYN, because she's an OBGYN, and we'll put in her zip code. And then we'll type in her name, Robertson, and click search. And now this will tell us whether or not she's in network. And here she is in network in Williamsburg, Emily Robertson. And we can do this for that other plan that we were also looking at, the Optima plan. And we can go back and we can record our results. And it turns out that this provider is in network for all three plans, which is great. So now we can look at the cardiology search. So let's go back. And here on the Anthem site, we can do a new search. So let's return to search. And here, under the Find the Doctor place, we're going to delete the name of the doctor we just looked at, Robertson, because instead we're going to look at cardiologist. So here for OBGYN, we'll change it and we'll go scroll up and find cardiology. And so we click on cardiology. And so this is looking within 20 miles, but we can change this to any value if we wanted. We'll start with 20 miles and we'll click search. And so for this particular plan, it shows us that there are 34, as you can see here, there's 34 cardiologists in network within 20 miles. Now maybe we want to find out how many are closer. Maybe they want to know how many are closer to home. So we can actually slide this over. It's not the easiest interface. Sometimes they let you type it in. So in this case, slide it over to 10 miles, and it updates the results, and it shows us that there's 13 providers that are in network. So we can do a similar search for the other carriers, and again, record that here. So you can see for Anthem, there's 13 and 10 miles and 34 and 20. In Aetna, there's 6 and 10 miles, but 44 and 20, and for Optima, there's different results as well. So now we can go look up the prescription drug. So let's go back to healthcare.gov, and in this case, let's go up to the Optima site, and let's click on, instead of Provider Directory, we're going to click on List of Covered Drugs. We click on that there. So now we have a PDF that lists all of the drugs and the tiers they're in, and this can be very overwhelming. So some insurance company sites let you go in and type the name of the drug, and it'll take you, it'll let you do an interactive search. For the PDF ones, the trick I use is I go to the upper left-hand corner to the edit box and find, or you can hit Control F as a trick. And type in the name of the drug, and it'll find it on the PDF here. So it'll search the entire document, and here it's found it. Metformin is converted to Tier 1, and you can scroll through. There's different formulations of metformin. Some are Tier 1, some are Tier 2. And so now we can go back, do the same search for the other plans, and record that information on the site. So for Optima, there's some that are Tier 1, some that are Tier 2. For Anthem, the versions of metformin they cover are Tier 1, and same with Aetna. So once again, we have a more complete picture of these plans, and we can help the family walk through what are their priorities now that we've taken into account some other things. So those include things like all the things we talked to Sasha about, but now things like, is your current provider in network? What's the size of the network, or in this case, the number of cardiologists? And are your prescription drugs covered or not? And if so, at what tier? So now, again, once again, they can hopefully be empowered to sort of make that decision based on their specific unique needs and how they prioritize these factors. Now let's go on to our last example. And so this is the Green family from Alexandria, Virginia. They make $45,000 a year. At their income level, their two younger daughters, they have 3 daughters. The 2 younger ones qualify for Medicaid, and the older daughter actually is not insured through Medicaid. So we're going to help them buy coverage for the 2 parents and the older daughter. So let's go back to healthcare.gov, and let's put in the information for the Green family. So we'll once again start with their zip code. And we'll put in their income of $45,000, and then we'll add their ages. The 2 parents are 43, the older daughter is 20, and the younger 2 daughters are 16 and 10. And so when we click Submit, in this case, it turns out that they're eligible for a tax credit of about $568. And it shows that the younger 2 children are probably eligible for Medicaid. We're going to say they're already on Medicaid. And they're also eligible for cost-sharing reductions. In this case, the 87% level because of their income level. So when we click on the plans, here's a couple plans. Right away you notice there's a free bronze plan. So this is a plan we could look at. It's an Aetna plan that has a $12,600 deductible. But when we scroll down, we see here's another plan that's also free that has a lower deductible. So in this case, we might, instead of choosing both of them, we might just say, why don't we look at this plan to compare? There's a couple others, but here's another free plan from CareFirst that has a higher deductible. So we can keep scrolling down, but one of the things we might want to offer them is there a plan that offers you some of that first dollar coverage, so some coverage before the deductible. And so we can keep looking, and there's a lot of plans that are very cheap, but they have very high deductibles and nothing exempt until we get to this one. It's a $21 plan from Kaiser that has primary care, specialty, and generic drugs exempt from the deductible, even though it has a $9,000 deductible. So again, these are 2 plans we could look at, but we know that these are high deductibles, and we know that they're eligible for CSR. So we might say, well, why don't we take a look at silver? It's going to be a little more expensive, but let's see what options are there. And so here we see that it's a $147 Kaiser plan, but you'll notice it's an HSA plan. So it has a $1,000 deductible, but nothing is going to be exempt. And so we happen to know when we were scrolling down that here's another plan from Aetna that's $170, has a $2,000 deductible, but it looks like it exempts things from the deductible. And in fact, everything happens to be exempt. A lot of things are exempt, and they have pretty low copays. So we might go with these 3 plans, but we might, there might be other options they want to look at. In this example, we'll just look at these 3. The free CareFirst plan, the $21 plan from Kaiser, and the $170 plan from Aetna that's much more expensive, but as you can see, there's a lot of things exempt from the deductible. So at this point, we might talk to them again, or maybe we talked to them earlier and said, what's important to you? Maybe they mentioned, they know about out-of-network coverage. They don't know exactly what that is, but do any of these plans have it? And that's something very easy to check. It's basically in the name. You don't have to do any searches for it. It's either an HMO or a PPO, point of service. The Aetna plan is a PPO. The other 2 plans are HMOs. So you might talk to them again, or maybe you asked them before, do you have any doctors or anything? And maybe they didn't say anything. But maybe now they mentioned, well, we don't have a doctor. We didn't have insurance last year. We did have some medical bills. But what's important for the mom is that she has access to a provider who speaks Vietnamese. And so one of the things we can do is say, well, how many Vietnamese-speaking primary care docs are there in network for these places? So we'll go here, and on the Aetna plan, we'll once again click on the provider directory. And it'll ask us, what are we looking for? And so in this case, we'll say we're looking for a primary care provider. So we'll click on that. It'll ask us for the zip code, so we'll type in the zip code. And then we can hit search. So now it's asking us for what plan do we want. And so we're going to go down here, and we're looking at plans. It's the 2015 exchange plans. We aren't doing 2016 yet. It's the on-exchange plans, and it's the Innovation Silver $10 copay. That's the plan we were looking at. So we'll click Continue. So now it tells us the total number of providers that are in network here. Not the ones that just speak Vietnamese, but it'll give us results for the total number. Again, this particular site happens to run a little slow. Or in this case, a lot slow. So here you can see there's hundreds and hundreds of doctors. You can see there's many, many different pages we can see, hundreds of doctors that are in network. But we want to know those that speak Vietnamese. In this case, we might just expand this search to 20 miles, just to give us a bigger radius. Well, it's not ideal that it's not the quickest site. For those of you that are working in this area, obviously this will be what you face. So this is sort of a real thing to look at. So we'll click down here on Vietnamese in the language section, and it'll update our results. And when it did, it ended up showing us that there's actually 55 Vietnamese-speaking providers, right here, 55 providers that speak Vietnamese and are primary care providers. We might want to see how many are closer to home, so we can just update that to 10 miles, and that'll give us, or sorry, to 5 miles. Because especially in this area where there are a lot of doctors, people might prefer them to be closer. So let's click on 5 miles, and it tells us that in that radius, when we did the results earlier, that there's 11 providers that speak Vietnamese that are primary care providers. So again, we can do the same thing for the other plans. In this case, we were able to find it for Kaiser. We were not able to find it for Blue Cross for whatever reason. The language access site wasn't working. So you can add this information on here, and again, it looks like a different array of how many options exist. Now, at this point, they might feel comfortable making a decision, but one of the things they might say is that they're just not sure whether they should pay more money for this silver plan. Then maybe they say they're not interested in the plan in the middle. They like this option that's free because it's free, and then they don't have to pay the penalty. But then there's this other plan that's more expensive. How can they understand whether it's worth it? So one of the things you can do is you can talk to them about what are your healthcare needs. Do you know how many times you go to the doctor in general? Or maybe, if they're not sure, how much healthcare did you use last year? So maybe in this case, they explain to you that across the 3 family members, they had 4 primary care visits a year, and since they didn't have insurance, they had to pay for it out of pocket. It was $120. Maybe across the 3 of them, they had 4 different generic prescription drug medications that they had to get filled, and they had to pay for it full in retail. And maybe one family member had a hospitalization that had a pretty big bill, $4,000. And again, they had to pay for the whole thing out of pocket. So if they bought the plan on the left, you can compare this. You can say the annual cost for the plan on the left is $0 a month, because it's free, times 12 months. And it's $6,400 for the deductible. So when you add the 2 together, it's $6,400. The drugs, the primary care visits, the hospitalization, when you add all that stuff up, it equals $6,400. And none of the deductible applies to everything, so they don't get to pay any copays for that. They have to pay the full cost. Now the plan on the right, the silver plan, is $170 a month. So that equals $2,040 a year in that plan, just in premiums alone. The hospitalization, they'll have to pay the first $2,000 because that's what the deductible is. But the copay for inpatient stay after you meet the deductible is 10%. So the balance of that bill, which is $2,000, you only pay 10% of it, which is $200. They'll pay $5 for each primary care visit, which is $20, and then they'll pay $5 for each prescription drug times 4 times 12 equals $240. So for the silver plan, they'd end up paying out of their own money $4,500 total at the end of the year. So they would have saved money with the silver plan. Now every year their healthcare needs might be different, and so it could be that they don't have a hospitalization. It could be that they're relatively healthy this year. But it sort of helps them understand what the value is of these more expensive plans that have lower deductibles and lower copays. So now we have some additional things to talk to them about, all the same things we talked to with the first 2 examples, but things like out-of-network coverage, things like any language preference for providers, and then this calculation of the lowest overall cost when you take into account not just premiums, but any anticipated healthcare costs you might have through the course of the year. And we're told that healthcare.gov is supposed to have something that's actually going to calculate things for this last bullet and do approximations of, based on your described health status. It'll tell you, here's a plan and here's how much it costs per month, but here's how much you might pay through the whole year based on some calculations we do. And so that'll be a useful tool, presumably once it launches, if we're able to use that. So again, with that, I want to close here with any questions we have before we adjourn for the day.
Thank you so much, Dave. Yeah, we've ran over a little bit, so are you okay staying for another 5 minutes here?
Yeah, I got a couple minutes, yeah.
Okay, great. And we'll try and do it in speed round here, so we'll get through as many questions as possible, but we will record the questions and respond to folks individually afterwards if they not get to that. One question here, a couple definitional questions. What does HSA plan mean?
So HSA is a health savings account. We talked about that earlier. That's the account that people can get and set up and put pre-tax dollars in and then use it to pay towards medical expenses as long as they buy a high deductible plan. So a plan is either deemed HSA eligible or ineligible. And to be HSA eligible, it has deductible above a certain amount. It was $1,300 deductible. And it can't exempt anything from the deductible except for that preventive care services. So in general, HSA plans tend to be cheaper, though. So when we're looking and when consumers are looking and they're looking at the cheapest products, often the HSA products will be the ones that are at the top of the screen. And so one of the tricks I do is to sort of look and see, if they want to look at an HSA product, that's great. But since, again, most of our consumers don't have money to put in an HSA and benefit from the tax advantage, I often try to scroll down and find where's the first non-HSA plan on the screen, because that'll be the one that probably exempts some things from the deductible.
Thank you, Dave. Next question is related to multi-state plans. What are those plans, and does that mean they have multi-state networks?
That's a great question, and I actually just recently joined the Multi-State Plan Advisory Board. It's their plan set up by the Office of Personnel Management in the federal government, and that's the office that buys insurance for federal employees. And so the Affordable Care Act tasked that office with finding insurance companies to create what they're calling multi-state plans, because they're used to doing that for federal employees because they have federal offices all over the country. And so some, in many states, not all, the network that they work with, but they work with Blue Cross and they're trying to work with the co-ops, but that may or may not last. They have these companies sell these separate plans that are multi-state plans. And there's 2 things associated with that. One is the multi-state plans have to meet certain standards. So for care disease management and OPM, the Office of Personnel Management, helps you if there's any issues with the company, so that sort of gives you some additional services. The second thing is they're supposed to be multi-state in terms of their network. So if you live in California but work half the year in DC, or you live in Virginia and work half the year in Illinois, it'll help cover you that. Unfortunately, the carriers haven't been required yet to create a multi-state network for these products. That'll happen over time. But so you'll see a product that's listed as multi-state, but it may not have a multi-state network. So for now, one of the things we're trying to work on in this advisory board is really clarifying that. You know, it'll have a product that has some additional services through OPM, but it may not have a multi-state network. And they tend to be a little more expensive in many markets right now. They're more expensive options. And the same carrier will have cheaper options. So if you're an assister working with consumers, it'll be important to double check, is the multi-state plan in our state, are they actually offering a multi-state network? If not, well, then that plan isn't offering that feature, and if you're working with a consumer, you know, make sure you understand that, because you don't want them to buy that more expensive product if it isn't adding anything onto it. But some states, they do have multi-state networks, so I'm not sure what the value is in Virginia.
Thanks, Dave. Question about HIV, patients with HIV, and trying to access services through the plans. Is that one of the ways? How would they search for that through healthcare.gov and to see services that are available to that population?
So if they're looking for clinical services, obviously you'd be looking for an infectious disease doc or a primary care doc. I mean, at this point now, just in terms of the advancement of treatment, you know, most individuals living with HIV are able to be managed in a chronic condition setting, and so many providers are capable of doing that. Certainly an infectious disease doc can. And so you would search in that way. If there's other ancillary services, those might not be covered by a plan. Although if someone qualifies for disease management by the plan, and that's something you can call the plan and say, you know, I have certain conditions and I want chronic disease management, does my condition qualify? They may have sort of a case management process that can help you ensure you're getting not just the clinical side, but the support services, social services. And then the biggest issue is prescription drugs. So making sure you're able to find out if someone's on antiretrovirals, what tier are those drugs in, are they covered or not? You know, we've seen some places in the country, like in Florida, where some of the insurance companies were putting all HIV medications in that specialty tier, the most expensive tier, even if it was a generic drug. And so they were sued because that seemed discriminatory, and they were sort of told to stop doing that. So, you know, really keeping an eye out for that. It's very important for people with any conditions, but certainly in terms of HIV, that's a very important thing to keep an eye out for the communities we work with.
Thanks. Just one last question on, you showed in the example you showed for Sasha, and I think the other ones too, how did you find out that the deductibles combined?
So on healthcare.gov, when you're looking at the screen, and we did it when we searched, and so I apologize we didn't show that example clearly when we were actually doing the browsing example. You can find it one of two ways. You can click on the summary of benefits, and it'll say it very clearly. There's a box for the medical deductible, and there'll be a box for the prescription drug deductible, and it'll either say combined, or it'll say here's a separate value. Or when you're on healthcare.gov and you're scrolling down, in fact, let me see if I can do that real quick. So on this plan, on the Aetna plan, it shows the deductible here is $2,000. When you scroll down on prescription drugs, there's a row here that says prescription drug deductible. In this case, there is a separate deductible, but it's zero. So the deductible, there's no deductible for the prescription drugs. It could say a value of $300, and that would be a separate deductible, or it could say included in medical, and that would mean that it's included in this $2,000, and it would be one deductible. So that's where you find that.
Great. Thank you so much, Dave, for today. It's been a fantastic webinar, and I think I hope folks found it useful. I will be sending out, after the completion of this webinar today, of course, the recording and the slides, and included in that, we will also provide links to the ProPublica site that Dave referenced. Also, the Health Reform Beyond the Basics, you see it there. It's a fantastic resource. I highly recommend it to listen to not just the webinar on the plan selection, but also all kinds of great stuff on special enrollment periods, exemptions, really great stuff from the Center on Budget and Policy Priorities. Thank you very much, Dave, and hope everyone has a great rest of their Wednesday.